Thank you for your invitation and the organization for the meeting. It's my second time to visit Finland. I love your country very much. China is a big country, as everyone knows. The newborn screening, the coverage of newborn screening reached 95% last year. But we have to face many challenges and many difficult problems. Here today, I would like to share our experience to everyone. In the end of 2018, the newborn screening of the coverage of newborn screening reached 96%. As you see, the coverage is quite different from area to area. In the East China, the newborn screening coverage is much better than those in East. South China is also better than North China. The newborn screening is start in China from 1980. It's about 38 years history. So the screening coverage increased slowly. The newborn screening panel is also different from area to area. The nationwide screening it's just for two disorders, PKU and congenital hypothyroidism. The payment is made by central government and medical insurance. But the newborn screening for congenital for CAH is only performed in 24 provinces. The payment for the treatment is made by most provinces by the local government. The G6PD deficiency is a common disease in South China. So the newborn screening for G6PD is mainly performed in South China. For example, Guangdong and some Guangxi, Fujian, and Hainan. The newborn screening using tandem mass, it just started 10 years ago. In Shanghai, Zhejiang, Guangdong, Beijing, Shandong, we have got some experience and the basic data for the inborn errors of metabolism. But the treatment and the payment is quite a difficult problem for the inborn errors of metabolism detected by tandem mass. In some provinces or cities, the payment is made by local government. But we have to face a difficult problem is to lack the medicine, like the drugs or special food. The current situation in China of CAH and G6PD as shown in the table. In the mid China, the newborn screening for the two disorders is and South China is much better than the than Xinjiang and some poor areas. The tandem mass screening for inborn errors of metabolism is just performed in some cities or provinces as shown in the tables, as shown in the figures. In the green area, the coverage reached 50%. but in most area of China, the newborn screening using tandem mass is not started now. The incidence of the inborn errors of metabolism is also quite different from area to area. As shown in the slide, the incidence of congenital hyperthyroidism is not so different from area to area. The incidence is the most high difference. I don't see, maybe in Ningxia, Qinghai, and some poor area, but the incidence of CAH is also quite different. The PKU in South China, the incidence of PKU is much higher than yes, the incidence of PKU is in South China is much higher than North China. Today, I hope to share the experience for the newborn screening and the high-risk screening for methylmalonic aciduria in China. We just finished the nationwide survey for the disease. The patient came from 26 provinces and cities of mainland China. The clinical data, biochemical features, and gene mutations were studied to evaluate the newborn screening by biochemical method and NGS. The blood, amino acid, and acylcarnitine, urine organic acid, and the plasma total homocysteine were determined for the biochemical diagnosis. For the most patients, a gene analysis was performed by NGS. The patients were treated by individually intervention on long-term follow-up. I'm happy to tell you 8 patients with MMA were treated by liver transplantation and improved very good. A prenatal diagnosis was also carried out for 165 patients, features of the family. As shown in the slide, in the 1,003 Chinese patients with MMA, only about 30% of the patients has isolated MMA. About 70 patients of our patients with MMA have combined homocystinemia. So it's maybe we have to evaluate our newborn screening program using tandem mass to pick up more patients with homocystinemia combined methylmalonic aciduria. Only 6% of our patients was detected by newborn screening, unfortunately. About 94% of patients was diagnosed by clinicians because after the clinical onset, from several minutes just after birth to 25 years old. They were diagnosed aged 3 days to 25 years old. The main clinical presentation were psychomotor retardation and metabolic crisis, and multi-organ damage, including hematological abnormality, pulmonary hypertension, kidney damage were found in our patients, later diagnosed patients. For the genetic study on our patient, 661 Chinese patients accepted genetic diagnosis using NGS. As shown in the slide, 7 mutations from 7 genes were found in 631 patients, but unfortunately, about 30 patients did not got the definite genetic diagnosis. The MMA-CHC mutations was detected from 460 patients out of the cases who accepted NGS genetic diagnosis. They with the combined MMA and homocystinemia. Mute mutation is the most common genetic defect, was found in 158 patients out of the cases of isolated MMA. Some very rare genetic defect, such as MMAA and MMAB and HCFC1, were also found in some cases. The outcome of the 103 MMA patients is quite different. The patient detected by newborn screening had normal development. It's a very good data. But the patient was diagnosed after onset. Accepted the patient, the prognosis is quite different. Only 45 patients completely recovered with normal development, and 6 of the patients got married. 26 patients died, and 4 of them were diagnosed by post-mortem diagnosis. 873 patients had mild to severe psychomotor retardation, even after the treatment. So the prenatal diagnosis is very important for the family. So MMA was found in 35 fetus out of the 160 fetus by biochemical assay and genetic assay. So for the newborn screening in China, we have to face many challenges and difficulties. One is the guideline for the new screening, diagnosis, and treatment for the disorders, especially for the treatable disorders. And further expanding program for other diseases such as SCID, LSD, DMD. The pilot study for DMD is also already performed in Zhejiang. They got very excellent data. And next, NGS screening in newborn screening is the pilot study is also performed in Shanghai. We will evaluate the data. Thank you for your attention.